Is the second part of the 6-part transport discussion series. This discussion series has been organized by Transport Research and Injury Prevention Program at IIT Delhi in collaboration with India Habitat Center. And some of you were there in the previous one, which was last month. So that last one, we started with discussion of what is the vision for city, because transport and the way cities are designed are very closely related. And summary of last discussion is available on the desk outside. You're welcome to pick up one, and then we will also make it available on the website. So for today's discussion, this is on transport and health. And as most of you must have picked up this brochure, and you can see inside that some key numbers are given here. Transport and health are also very closely related subjects. Transport has an impact on human health in many different ways. So today, to chair this session, I would like to invite Dr. Mathew Varghese. He's former director, St. Stephen's Hospital, and at present HOD, Orthopedics Department at St. Stephen's Hospital. Dr. Varghese, can you join us? And then we have two very eminent panelists, I would say, because they have been working in this area for a long time. And first, I'd like to invite Anumita Roychaudhary from Center for Science and Environment. And she's been managing the vehicular emission, what is the track called that you manage? Air pollution and vehicular emissions at Center for Science and Environment for a long time. And then we have Dr. Sarath Guttikunda, who is from urbanemissions.info. This is the website and the program he manages. And he's been working also in many cities in India, actually looking at emissions, what's happening to urban emissions, not just transport, but other sources also which are having an impact on urban emissions. So now I hand over to Dr. Varghese, and like last time, the format we will follow is we will have first the two presentations, and after that we would like to invite our two expert panelists who are not on the dais yet, but Dr. G.R. Sethi from Maulana and G.C. Khilnani from All India Institute of Medical Sciences. They will tell us a little bit more about what's happening in Delhi and health of Delhi residents because of vehicular pollution. And then we will open it out for...
Thank you, Geeta. Good evening, everyone. Pleasantly surprised by the numbers right on the dot. That's really good. Thank you, all of you. As Geeta mentioned, this is the second in a series of six sessions that we have on transport and health and transport and moving around. We have our first speaker, Dr. Anumita, giving her presentation.
Thank you very much, Dr. Varghese. And I'm really very delighted to be here with all of you today, just to have this opportunity to discuss this issue, which is so emotive issue for us. And it's a battle on air pollution and public health that we have now been trying to fight for now nearly 2 decades. And clearly, all these years, and we have just seen how this problem has grown, changed in its character, and the bigger battle has been to really understand what the solutions are and how do we fight for that solution and find the solution and make it happen. If you look at, every winter, you will see these headlines in Delhi today, every winter. And that's when air pollution is most visible. And particularly over the last 2 years, if you've seen the speed of studies and the numbers that have been crunched in India and globally, they're only giving us mounting evidences to show that how difficult this problem is becoming and how serious and alarming it is. So when last year, global burden of disease estimates were made available, and this, as you know, is where the scientists across the world, they sit together and they try to understand different risk factors that contribute to or cause deaths and illness. And when they looked at 67 risk factors, and on the basis of that, they said that in India today, air pollution-related diseases have emerged as the fifth largest killer.